I definitely wanted to come to a residency program that had a focus on patient equity.
As a med student, I was pretty involved in access to care advocacy. I was just really lucky to be with a big group of med students who cared about this a lot.
Emory was a very prestigious place. It was a very hard-working place, but I wasn't really sure if they would have a space for me and my values. So it was my interview day at Emory. We're sitting in this hall and Dr. Law gets up there and the first thing she says is, medicine is about service. I hadn't heard that anywhere else.
There's several ways that residents can have a direct experience with health equity and advocacy. The most obvious one is that they train at Grady Hospital.
It's just the most amazing place to see the impact of social determinants of health.
There is the social medicine distinction program, for example.
The social medicine distinction focuses on the social determinants of health and then the tools that we need to achieve health equity. Going on home visits, shadowing a community health worker, going up to the Capitol with lobbyists to see how policy is crafted at the state level and how our voice can really change that.
The CDIC, the Churchwell Diversity and Inclusion Collective, it's a resident forum group supporting underrepresented medicine residents. And then there's a lot of community-facing work that the CDIC does.
The CDIC Advocacy branch does all sorts of things from hosting weeks of action to help residents find ways to advocate in their everyday lives.
There is a lot of work being done at the Pond Center to try to even the playing in terms of HIV outcomes.
We realized in early July that there was a great opportunity in Georgia to help our patients through voting. We wanted to make sure that every resident had a plan to vote. We actually got residents to get this badge so patients could scan the QR code and check our early voting location, request an absentee ballot.
Advocating for human rights is something that has been ingrained in the fabric of this city. This is the bed of the civil rights movement. This is the birthplace of Martin Luther King. Emory has taken that on.
It's important to go somewhere where you're going to feel inspired.
Dr. Law and the rest of the residency administration has been incredibly supportive.
Anytime that we want to do something, all we have to do is just send an email.
It's just so rare to have medicine leadership and a program director and all this faculty that are really excited about this work.
You're not doing this work alone.
Residency is tough anywhere you go, but you really want to be somewhere that the people that are around you really share your goals.
When you sign on to become a doctor, you give up a lot of your life. Although we give a lot of service, I think the job gives a lot back to us as well. And if we do it right, it really serves to make us better humans. One of the things that I love about being at Emory is it's sort of a constant reminder to not forget your humanity.
I think health equity, advocacy, and policy will shape the future of the way that we train physicians.
To all medical students who have an investment in advocacy and health equity, Emory is the place for you.
If that's why you became a doctor, a huge part of what you want to do, you have to come here.
You will be surrounded by residents who share your common goals.
The spirit of service that had been mentioned on that initial interview day was exactly how people lived their everyday lives here.
We don't want to be performative. We want to really fix the system here, fix the system at our hospitals, fix the system in the country, and there's a lot of work to do.
We're not just saying we're about it, we're being about it.
Being here has been amazing because it feels like I found a home.